Breast cancer is the second leading cause of cancer death in women. In the first, our BNC Be Well series, we introduce you to a survivor who says medical racism nearly missed her diagnosis at the tender age of 31. So she turned her pain into purpose.
Hi, I'm Mae McCarmo, president and founder of the Tiger Lily Foundation. I'm a 15-year breast cancer survivor, thriver, warrior, and unicorn. My job has been to keep speaking my truth to power, to keep realizing that I am the power that I have. One day in the shower doing a breast exam, I found a lump on my breast, and the lump kept growing over time. So I kept asking her for a biopsy. The doctors kept saying to me, "You're too young to have breast cancer. You're too young to have breast cancer." I was 31 years old, under the age of when women get breast cancer.
My name is Dr. Jacqueline Walters. I'm better known as Dr. Jackie. I am an OBGYN. I've been practicing medicine for 25 plus years. There is no woman who's too young for breast cancer if she has breast.
My name is Dr. Arnethia Sutton, and I am a postdoctoral fellow at VCU School of Medicine. Among Black women that get breast cancer, approximately 21% of those women are going to have triple negative breast cancer. When you compare that to women of other races and ethnicities, that's somewhere between like 10 to 12%.
One of the major issues is racism. It's dismissal by this healthcare system. I was dismissed myself.
I constantly say every day, be your own best advocate. You know you better than I do. So if you think something is wrong, don't accept me saying it's not.
The patient is the one that has the power. You're meant to work for us and serve us, not the other way around. The Tiger Lily was birthed out of, my experience and me asking God how to serve. And our mission was to educate women who are younger, to advocate for them, to empower them, and then to support them during breast cancer.
We've come a long way with treatment from back in the day when it was just surgery only to we got radiotherapy and now chemotherapy. And now we have immunotherapies or more targeted therapies depending on the type of cancer that you're diagnosed with.
I have learned that prayer and meditation are my biggest assets. I have the most epic self-care routine. Sleep a lot, supplement. I like fresh air, a juice. I just really believe that, our bodies are a temple. It's a temple that God put our spirit in. And so as long as I'm here, my job is to honor what God's given me, which is my spirit and the temple that it's in. My daughter, Noelle, she is my biggest gift. She's 18. As I grew and as I began to be a light for my sisters, I began to reach back and light their candles as well. But I believe that when you know better, you have to do better. That means bringing other people from where they are with you.
Yeah, only 69% of Black women start treatment for breast cancer within 30 days. This past summer, Tiger Lily Foundation awarded $700,000 grant to launch community-based patient advocacy program to end disparities for Black women facing the disease. And earlier this morning, breast surgical oncologist Dr. Vivian Bea laid out the signs and symptoms of breast cancer. Let's listen.
So the signs are, I said, do your breast exam. So you want to look and feel your breast. You want to feel underneath your armpit. Many women don't know that a sign of breast cancer can be a mass underneath your armpit. I'll preface it by saying actually this as well. When you get a COVID vaccine, you may have swelling under your armpit, so don't be alarmed. Go see your doctor, but I'll just sort of say that because we have found that. You also want to look for redness and swelling in your breast. That can be a sign of breast cancer. Nipple discharge. If you are not a lactating woman, if you're not breastfeeding and you have nipple discharge, and this is discharge that happens on its own, it's spontaneous, it's not that you're squeezing it, that's a reason to go seek attention. And the discharge can be bloody, it can be milky, it can be brown, it can be green. Go seek attention for nipple discharge. You also need to look for thickening of your breast. So if you know that your breast is not as thick and then now you see that it's sort of swollen and getting thicker, that's a reason. Extreme pain, and I think we sometimes forget about this because pain in breast pain is actually a common complaint in women, just women in general. But if you have extreme pain or you just have this pain that just seems to not go away, go get attention. And then finally, you want to look for nipple retraction. And nipple retraction is when the nipples go inward, that is a sign of breast cancer and a reason why you should absolutely seek attention from your physician.
Yeah, there's such important warning signs, but I think in that piece, one of the most important things, the package that ran before, is advocating for yourself. It is true. No one knows your body like you do. No one knows your breast, hopefully, like you do. And so if you're not doing those monthly screenings, and so many of us don't, so many of us are behind, including yours truly, on our mammograms because of the pandemic. I'm desperate. Wellstar, can you hear me? I can't be on hold for hours at a time, days in a row, but I'll keep at it until I can go ahead and schedule it. I wish I could just do it on my chart. But, you know, what we talked to Dr. B about, Mike, was how they put out these recommendations, and it changes from time to time, and it puts us, Black women, at a disadvantage because they put out the recommendations for the masses, white women, and that's not our story. Age 40, she said, every year. That's not always what your doctor's going to say. And that's why what I said to her, and she said she agreed, that's why I seek out Black doctors. Look, I want the best, and Black doctors are, of course, right there. But I want someone who's not going to dismiss me and who understands what we're up against and is going to say, yep, you're Black, here's what you need to do.
There's a problem. Looking at that piece, 40% more likely if you're a Black woman to die of breast cancer than your white counterpart. And that goes up to 50% if you're over 50. There's a reason why. Like you mentioned, it starts with us. It starts with Black people first and foremost to advocate for yourself, to do the checks. So I hope, Sharon, that despite the pandemic, and despite the fact that Wellstar, whoever, is not corresponding with you properly or whatever, that you go in demand, that you be seen, because we need you here.
Oh, I'll drive there.
We have to have that. Yeah, I know you will. But, you know, it's important for you guys to continue to do that every single month, and men too, because, you know, even though it's very rare, men can get breast cancer as well. So you can't avoid those signs and just ignore those signs. But speak up and advocate for yourself. Scream, yell, shout. If you're not being heard, make sure they hear you. Black people, we can make some noise. So when it comes to your own health, make some noise. Make sure that they're being heard. Use social media. Call us. Do whatever it takes to make sure that you're being heard so that we can bring these numbers down. And the sad part about it is, Sharon, is that how many times have we done these health segments? And I'm happy that we're doing this because we want to put that information out there for everybody. But how many of these segments have we done talking about diabetes, talking about sickle cell, we're talking about breast cancer, we're talking about anything that has anything to do with health, how it disproportionately affects us as Black people. And there's a reason why. Because they're not hearing us, they refuse to listen to us, and we're not advocating for ourselves, and we definitely got to do a better job of taking care of ourselves as well. So all that goes into it, but we have to do a better job in all aspects in order to bring those numbers down. And just stamp it out completely.
Yeah, you're right.
So yeah, go out there, do what you got to do.
Yeah. Black in America, it's a heavy lift, but you can do it. We can do it. Everything else we're up against, got to take care of yourself too. That's really number one, because we can't do the other things and do them well unless we're here, healthy, here to advocate for our kids too, our parents. So yeah, I couldn't agree more.